Thank you so much, Adrienne, for being with us here today. I have with me Adrienne Abbate, who is the Executive Director of the Staten Island Partnership for Community Wellness, who are employing collective impact to tackle youth substance abuse on Staten Island. Adrienne, tell us a little bit about what collective impact is and how your venture is, what makes it different from another venture.
So, first of all, I'm happy to be here. Thank you for inviting me. So I think to summarize it, collective impact is a framework that communities and stakeholders can use to address complex social issues. How it differs from other projects or coalitions is that it's not really an appropriate approach, or it might not be the most appropriate approach for something that has a discrete solution to it. So educating the community around one topic is a specific project, but for something that's complex, that has many root causes and contributing factors like poverty, like substance use, like academic success and segregation in schools, things that are really kind of the tricky, complex issues where you require many different systems to really address the issue and co-create solutions, that collective impact is an appropriate and effective way to bring those partners together.
So it sounds like when there are several people or several stakeholders already working on the same societal challenge, rather than each one working alone, how can the impact of the whole be greater than the sum of its parts?
Right. It's aligning the expertise and resources of many different partners and organizations. It also is not always organizations and systems that might not already be working on the issue, right? So again, they might not see their role initially in a substance use prevention task force. They might be an organization that runs youth engagement or so collective impact also can involve organizations that might not necessarily be working on this particular issue. So you're aligning lots of different organizations and systems in terms of resources and expertise, but you're also bringing in some partners that are cross-sectoral, right? You know, that NYPD might not necessarily know their role in substance use prevention.
As an opioid stakeholder.
As an opioid stakeholder, for example.
Yeah, we've been talking so much about systems change in social entrepreneurship, and what is the difference between providing a social product or service and changing a system, which entails changing the way other stakeholders behave. And so it's hard to wrap your head around what is the system that influences opioid use on Staten Island. And so it's not just the grassroots organizations already working on substance abuse, it's also the police department,
Absolutely.
Education, health, etc.
Yeah, so we did some early work when we were forming our Tackling Youth Substance Abuse Coalition to really look at the youth as the center of our model, and then do some mapping to see all the systems that they intersect with and what could potentially influence a child or a person in general to use substances. And that's kind of how we started to bring some of these systems to the table. And I think another thing that differentiates collective impact from a regular coalition or a discrete project is that it's not one more thing that you're asking an organization to do. It's to really dig deeper and look at the mental models that are holding these issues in place, and asking those systems and organizations to shift those mental models, like to really think about doing the work differently so that it's sustainable, right? If you ask a person just to implement one program, when the money runs out, the program will go away. But if you shift the way that people approach an issue so that it's integrated into their existing workflow and nuanced, then it will be sustained even when the funding runs out. So,
what about the collective impact initiative itself? Is that something that's also at risk of going away when money goes away or interest goes away? How do you sustain it?
So this is a tricky issue, and something that I think backbones across the country are dealing with. You are always wanting to create situations where the partners and the members of this initiative will be able to sustain the work. But in order to continue to support a collective impact project, you do need to have some resources to support the backbone. The backbone, I think, is another unique aspect of collective impact that differentiates it and separates it from other projects. Having dedicated staff or resources to facilitate the meetings, to collect the data, to share the information, to keep the partners on track. to really provide this structure so that the different members can come to the table and co-create strategies and think through long-term visioning for the community.
And so was your organization seems to serve as that backbone to bring together all the different stakeholders. Was it formed for this initiative for tackling youth substance abuse?
So the Staten Island Partnership for Community Wellness was already in existence before this TISA coalition formed, and it was not the immediate, choice for backbone. I think that the community did some reflection and really thought through different models. Could it be philanthropy that supports it, or a treatment program, or a hospital? And there was a decision made among the steering committee that as the Staten Island Partnership would become the backbone because it aligned with our mission. We had a public health background. And it just, we had the support of our board, and we were already, looking across the borough to identify emerging health issues and activating community partners and aligning resources. So we had a lot of it already in play. We just didn't have the formal language to talk about it in terms of collective impacts. It was an opportunity for our organization to kind of strengthen these core competencies.
So what results have you seen? When we talk about collective impact, it means how can the whole be greater than the sum of its parts? So how do you measure that whole? Is it the same impact metrics that you would use to measure individual organizations? What does success look like?
Well, as a group, TISA identified some long-term outcome measures that were ambitious, that really looked at youth substance use rates in our community. So those were our North Stars, right? So we looked at alcohol consumption, opioid analgesic use among youth. We started to track marijuana. Like we have these outcome measures so that we know that if we are working in this very intentional way, that we'll see some change in over the long run. But then we also are tracking other measures of success in terms of partnerships, in terms of resources coming into the community to work on these issues, in terms of us being a trusted resource in terms of providing content for advisory councils. Again, we're really getting recognized for our ability to convene experts across the continuum to help shape these solutions.
And so to garner support for this topic.
And to garner support for this topic, a topic that substance use in general has not been one that's easily embraced among politicians and community members, but I feel like because we've been so forthright in owning it, and the leadership from our local elected officials and from the heads of our hospital systems and our CBOs, that we are owning it, addressing it, and trying to bring resources and recognition to the work that's happening in our community.
So it sounds like the impact of collective impact goes beyond tackling youth substance abuse, which is this one target that you've been calling TISA, but it is decreasing youth substance abuse. Are many, I'm sure, represent your metrics, and also changing the way that all these stakeholders work together, which positions you to work on other topics in the future and change the way youth are influenced on mental health, on many other issues.
Yes. So again, when we originally formed, it was around youth substance use, and even though we saw that we had high adult rates as well, but we made a very intentional choice to focus on the youth with the idea that if we change the systems that impact youth, that it will trickle up and impact larger communities and adults. When we were forming, again, we spent a whole year actually looking at the data and talking to stakeholders and learning from other communities about what they were doing, so that we had a very specific plan. But we always knew that there would be other things coming down the pipeline. So we knew that mental health played into youth substance use rates. We knew that it would impact different socioeconomic groups differently, but we made a decision to focus in our initial first 3 years, borough-wide, prescription drugs, including opioid analgesics, alcohol, again, based on the data. We knew that marijuana was coming, that we had high rates, but how do we focus for this initial period? But it created opportunities and systems for us to be fluid and address other issues as they surfaced.
So it's really the ripple effect of tackling youth substance abuse on society.
Yeah, and in how partners work together. And I think, what has happened now in our community is that we have several collective impact projects TISAs are probably most established. It's been in existence since 2011. But now we're using this approach to look at equity and success in public schools, and we're looking at it in terms of perinatal outcomes and obesity and asthma, because these are all complex issues that involve many different systems and partners. Now what we're trying to do is using kind of some of the lessons learned from TISA and thinking about how do you support all of these collective impact projects across a borough of New York
So
City.
the same backbone organization now has multiple collective impact projects.
So we as a backbone are supporting 2 to 3 collective impact projects, but then there are other backbones in our community that are working on education and success. We're part of these initiatives, but they're different backbones. But so how do we kind of create some coordinated backbone support to avoid meeting burnout, to align the resources and efforts so that there's one comprehensive model of child and family success in our community. And we're pretty excited. We're creating a constellation of North Star high level outcomes to guide the work.
Yeah, and what I didn't realize going into this is that you do have these different outcomes, like the different verticals that you're working on, and part of this impact that you otherwise wouldn't have if you worked alone is outcomes that might be harder to measure, like you're building trust between different stakeholders in the community, you're building relationships, and this is going to influence substance abuse and multiple outcomes.
Absolutely.
And that's how you change the fabric of society, not just specific metrics. Thank you so much, Adrienne, for
it's my
being with us
pleasure.
here today.
Thank you.